morning, everyone. Welcome. My name is Kathy McCarthy, and I take care of programming for adults here at the library. So if there's any adult interest in any particular topic, give me a holler after the session today, and I'm happy to work with you on something that interests you, because if it interests you, I'm sure it'll interest other folks in the community. Today we're going to talk about telehealth and all of the resources that are available to you. And we'll also be recording this for our YouTube channel. Library's a happening place. We have a YouTube channel. And so we're going to welcome our guest panelists, and I'm going to ask each of them to take a few minutes to just tell us who they are, and then we'll get into individual discussions and presentations that they have. So quickly, this is Heather Roberts. Welcome, Vice President of Operations for Heart of the Rockies. This is Ron Terry. He is the president of the Hospital District Board. Is that what we call it, Ron?
Yes.
Okay, I want to make sure I get that right. This is Desiree Lipka. And what would you describe your title as?
Consultant.
Consultant.
Supervisor.
Okay. And then welcome Jenna Calkins, and she is my library co-director for the West Custer County Library. So why don't we take a few minutes to have each of you say a few words about yourself, and then we'll get into the topics.
Great. I'm Heather Roberts. I'm the Vice President of Provider Services for Heart of the Rockies Regional Medical Center. So my role is to oversee all of our physician practices across the region that we serve. Happy to be here to provide some background on telehealth and what Heart of the Rockies can contribute.
I'm Ron Terry. I'm the chair of the board of the hospital district. I've been a resident of Custer County for 14 years. For 7 of those years, I was an EMT in the EMS operation, so I've got some insights to that group, and happy to be here today.
Hi, I'm Desiree Lipka, and I have been with Solvista Health for about 26 years and have lived in the county 24 of those years. I am a licensed clinical social worker and spent most of my career doing direct service in the mental health realm. Currently, I'm a consultant with Solvista, and I supervise interns and clinicians working on licensure.
And I am Jenna Calkins, the collections co-director here at the library. So I'm mostly in charge of collection development and purchasing all of the books and other materials in the library collection. But today I'll be here to talk about some of our resources that we have available at the library related to telehealth.
All right, thank you, everyone. And why don't we have you start, Heather? I believe you have a presentation for us today.
I do. I'm going to talk a little bit just about what telehealth is, what the challenges and benefits are, talking about what's appropriate for a telehealth appointment versus in-person care, and then talking about how our local clinic can support telehealth for people in this community. So telehealth is really the delivery of healthcare, medical services, and behavioral health services remotely using things like your computer. Everybody has a smartphone now, or an iPad, things of that nature. It can also be done just with audio only via the telephone in some cases. Telehealth really exploded essentially during the health crisis with COVID and the public health emergency, and it has really just continued to grow since then. I think that the pandemic taught us really how to use telehealth, and that it was really a good option for a lot of people, and now we're kind of adopting those practices as kind of a part of our normal healthcare services now. Telehealth, I think, is important for rural communities, especially due to all of the reasons that we already are aware of: the long distance for travel, being isolated in different parts of the state or region where there isn't quick access to any services, And telehealth really makes healthcare in rural communities more robust by being able to offer more. The benefits, time and money are a huge one. Less time spent traveling for patients, less overhead on the physician practice side to be able to deliver telehealth. It's a lot easier to do and accomplish than coming in for an in-person appointment sometimes. It increases access to care, particularly for chronic disease management, which is a perfect thing to be able to accomplish via telehealth. It oftentimes can allow faster appointments, especially to see specialists. And for patients, it does provide less risk for exposure. We saw that specifically with COVID, and flu season is another great example. It helps people who are at high risk not have to be in waiting rooms or to be out in places where there's other sick people.
Heather, can I add one that I saw this morning when I was looking at this, and that was reprieve for caregivers, right? Like,
Yeah.
so that they don't have to.
They don't have to travel with them, and I'll talk in a second again about specifically it also helps family members and caregivers participate in the visits. Some of the challenges and risks of telehealth, diagnostic errors, obviously there's limitations to what can be done via telemedicine, like an inability to perform a physical exam or hands-on in some cases to be able to achieve vital signs and things like that. It's a little bit impersonal, especially if you haven't met that provider in person before. Some people struggle a little bit with the kind of the digital framework to feel like they're connecting. Technical issues are always a barrier. Our technology is great when it works, but sometimes can be unreliable, particularly if you live in a rural area where connectivity can be a challenge.
Regularly up here.
Yes.
No kidding.
Yes, and you know, when you're in a healthcare visit with your physician, you want to be able to fully engage and not have to worry about freezing screens and choppy audio and things like that. There's a lot regulatorily that can be a challenge. There's a lot of variation from state to state about rules and licensure and guidelines for practice. We also saw recently tons of telehealth practices popping up that are solely telehealth and internet based, you know, and there's a little bit of apprehension. How do you know they're legitimate? How do you know that you can trust the person on the other end? Particularly, you know, a lot of these weight loss companies popped up overnight on the internet offering telehealth, and, you know, a little bit of leeriness around that. And then vulnerability for privacy and security, always wanting to make sure that you're using a HIPAA compliant platform. With Zoom, after COVID kind of boomed and we started to do telehealth, they developed a HIPAA compliant platform. Because people were showing up in Zoom rooms, hacking Zoom rooms and things like that, and so they were able to come up. Yes?
Heather, how do you know if it's a HIPAA compliant platform?
I think you have to ask those questions.
Okay.
Most hospitals or healthcare organizations will be using a HIPAA compliant platform, but I think it's a great question to ask if you're going to engage in telehealth.
Okay.
Appointments that work well with telehealth are medication management, so just check-ins on medications you're already being prescribed, appointments for refills, starting a new med and just want to check in to see how it's going, test result review, you've already been in to see the physician, they've ordered some tests and now we just need to review results. Behavioral health is a great platform for telehealth. It makes access a lot easier for people. Chronic care management, like I talked about earlier, you know, you've had hypertension or diabetes for many years and you're pretty stable, but you just have to have those, you know, 3 months or 6 month check-ins with your physician. Minor urgent care issues, things kind of like cough, cold, if you get chronic UTIs and you're very familiar with symptoms, skin issues like rashes, things like that that can be just visualized are helpful, and then specialist follow-ups. Appointments that are better in person, certainly emergency medical care. You should not attempt to achieve telehealth appointments for anything like chest pain, stroke symptoms, neurologic symptoms, difficulty breathing. We would suggest you call EMS and get to the hospital. Any new or worsening symptoms, so anything that's new for you, worsening pain, things that you haven't been evaluated for, best to have that done in person so that physical hands-on exam can be performed. And then any type of routine appointment that requires a physical exam, like a well woman exam, things like that really should be done, child visits should be done in person because they really do require a physical exam. Falls or injuries really should be in person, and of course any procedures or wound care is best done in person. Telehealth specifically for seniors. Telehealth is great for all ages and all populations. Your family can join the visit, which is really nice. Sometimes they even will allow family from somewhere else, like as a third party in the Zoom room, to join the visit so that they can also interact. So it's great to be able to have caregivers and families join and be a part of the visit. Staff at our clinics and at the library here can help with the technology if that is a barrier for people. We don't want that to be the reason why some people may not seek care. So absolutely there's resources to help with the technology. Like I said earlier, phone visits sometimes may be appropriate, so you don't even need to deal with the extra technology. We can just do a phone visit, and the more you do it, the easier it becomes. How we use telehealth at HRMC, we use it, almost all of our specialty clinics and our family practices do utilize telehealth appointments. For patients, all they have to do is request that their visit be telehealth. We have exclusive behavioral health, our behavioral health provider is exclusively telemedicine. It helps with specialty collaboration. So if you're seeing a physician here for your primary care and they want you to chat with urology or pulmonology or someone, we may be able to facilitate a visit sooner with that specialty via telehealth than waiting for them to come once a month here to the clinic. And it also helps expand access across all of our locations. Our clinic here, Custer County Health Center, can be used as a telehealth hub for those who need assistance with the technology. You don't have to do this from home. You can come into the clinic and we can help facilitate that visit for you. You can sign your consents. We can get you hooked up on to the platform. It's also really nice because we also have nursing at the clinic who can do the vital signs and do any sort of assessment that may need to be done, so we can broaden a little bit more on what can be done via telehealth because we do have a medical professional there at the clinic to help facilitate. But we can help connect to any of our specialists within our system.
So Heather, if you call for appointments, like so you want to see a specialist is when you normally do this? You call our clinic. I mean, how do you set it up?
Sure,
What's
yeah.
the logistic?
We're gonna
You're
get
gonna get there, never
Yep.
mind, I'm sorry.
Yep, so to schedule specialty visits through our outpatient pavilion, patients would just call to schedule their normal visit. They would request that the visit be telehealth.
Okay.
If they would like to come to Custer County Health Center to facilitate that visit, all they have to do is call the clinic and just let them know they just need telehealth facilitation, and they'll put them on the nurse schedule.
Okay.
Versus the provider schedule. And they'll block that time for the patient to come in and set them up in a room and get everything started. And there's the numbers to reach all of our clinics there, Custer County, and our outpatient pavilion, which houses all of our specialists. Thank you.
That how you do it is always gets in my way, right? Like when I think, like if I don't regularly see a PCP and I feel the need to come in, but I don't want to have to make an appointment. Like I got bit by a tick and I wanted to talk to somebody about it, but I didn't necessarily didn't want to wait 2 weeks to go in and see someone. The process is just call the health center and see if there's something earlier via telehealth? Or,
Yep, and we're happy to do that. There also is a lot of online platforms for urgent care type visits that you can see doctors on demand, things like that. Again, you know, you're not going to know too much about that person on the other end and what their experiences or credentialing or anything is, but there's
So that's like a
options.
third party.
Yeah,
company.
so there's lots of third-party applications available that are pretty reputable for like minor urgent care type visits that you can do from home. But like I said, you know, we offer quite a bit at the clinic and always willing to convert a visit to telehealth.
And when you guys do it, it can be either from my house and you'll send me a link, or from the clinic if I want help.
Yep.
Okay.
If you do it from your home, we call you in advance of your appointment. We do have to go over risks and benefits and consent for
Okay.
telehealth. And once we have that completed, then we stay on the line with you while you access the platform, get in the Zoom room. Once you're in the Zoom room, we'll disconnect and then we'll let the provider know you're ready. They'll jump in the Zoom room and you'll start your
Okay.
visit.
So at the scheduled time, you'll call.
Mhm.
Do you email a link for a meeting ID?
They email it or they'll just give it over the phone.
Okay,
They text. I think they do a lot of texting as well.
okay.
So how quick is that turnaround time that you can actually get that nurse appointment, or?
It just depends on what
Visit with the
specialty you're
specialty.
trying to access. Some specialties have a little bit longer of a wait. Some you can get in much sooner. It just depends on what service you're trying to access.
And can you do it with your PCP as well as a specialist?
You can, as long as it's an appropriate appointment type.
What percentage of your visits are probably telehealth at this point? Would you be able to hazard a guess?
I think it depends. I think some specialties it's a little heavier than others. In primary care, I would say it's probably 10% or less. Specialties like we do a lot of urology follow-up via telehealth. I would say that's probably like 15 to 20%. Some post-ops can be done telehealth as long as the patient's not having any kind of complications. I think it just really varies across specialties.
Do you see any trends at Heart of the Rockies, considering cuts to rural access and care, that they're using telehealth as a reason not to provide a broader set of services in rural communities?
My experience is no, but I can really only speak to our region. I would say in general, we're definitely not pushing telehealth. We would prefer organizationally to be available in communities. Why we send up specialists here, and we're always looking to do, try to expand what we offer in person. Reimbursement for telehealth is still a little bit inconsistent, and I think that's probably part of the driver. I would say if telehealth was reimbursed better and Medicare was more on board with telehealth, that could drive more of an expansion just industry-wide, but it's still a little bit.
So it's not always covered by Medicare?
It's not covered as well as an in-person visit.
Your reimbursement or
particularly
for the patient too?
For the hospitals.
Okay.
But it's not a barrier either. Like, we're not gonna not do telehealth because of it, but we're definitely probably not gonna try to exclusively push telehealth either, if that makes sense.
I was curious how you bill for that type of appointment where a nurse at the clinic might do some vitals and it's telehealth.
So at this point in time, we're a rural health clinic here in Custer County, and we would do it as a community service. We wouldn't bill any sort of additional fee for the clinic. There is an option to bill for distant site, which is the location where the patient is, can bill a small fee to Medicare, but we are at this time not doing that.
Interesting.
Is there any group out there lobbying on behalf of patients to Medicare to try to change the situation with billing and telehealth?
I think in the rural space there is. without getting too into the weeds.
Yeah,
on
I don't wanna
reimbursement.
get in the weeds, but I was just curious as to, 'cause it sounds like a barrier.
Yeah,
to
I
me.
mean, rural health clinics particularly, telehealth up until the pandemic wasn't even reimbursable at all. And then when the public health emergency occurred, they allowed our rural health clinics to participate in telehealth, but at, like I said, a reduced rate. And it hasn't quite caught up yet. Other private payers, will reimburse pretty close. Medicare's still lagging behind, but, definitely in the rural space, we've been trying to get final rulings on telehealth for a really long time. They just keep extending what occurred in the pandemic, because they can't decide either.
That's unfortunate. And does anybody have any more questions for Heather? Or if you think of any, you can certainly ask as we roll along. Ron, would you like to, Heather, thank you for your presentation. How about Ron, would you like to go next?
Well, I'm sorry I'm following Heather. She's done such a good job with this. And I think we would all agree that a lot of the things involving telehealth are going to have to be educational in terms of how do you get the word out to the folks, overcome any anxieties about participating in it. And as you know, Custer County is such an older county in terms of just the demographics. Old folks like myself are sometimes concerned about doing all these gadgets and what have you. So that's one of the things that we're going to have to overcome. I'm going to speak more directly toward EMS because that's why I'm here. And we're hoping that in the next 6 months to a year, depending upon a new program that's just come into exposure, that we can take the telehealth program one step further. And that's the Rural Transformation Program, which basically has given Colorado an opportunity to support rural, our frontier counties, and there are 52 of those I found out recently, working with one of my compatriots, of rural or frontier counties that would qualify for grants from the state under this new program. And basically, it's called the Mobile Integrated Health Program, and a big word, acronym for taking the telehealth program one step further into folks' home. Some people have transportation issues. We're finding that that's a big deal with our aging population. And there are times when it would be easier for that person to have someone come to their home and set up a scenario where he or she, the patient, can talk to that primary care or specialist from the comfort of their home. They're not having to get into a more sterile environment like the clinic. They're able to meet with, in this case, a paramedic who is trained to work with that person in their own domicile. And how that would look would be they either scheduled an appointment or they called 911 and said, I need some help. And that trained paramedic would go out there, and there would be on the other end of that television a primary care specialist or someone, an emergency doctor, someone who could see that person literally in their homes. And after the paramedic had taken vital signs and done the other initial things that you would in an emergent case, connect that person directly from their home to see what was going on. In some cases, it may mean transport of that individual. In other cases, it may mean just writing a prescription and having that set up in some way. So it's really a step further down the road to being electronically oriented, maybe patient friendly, or maybe even patient more friendly down the road as this program evolves. It's still in the very early stages. There's still a lot of questions about compensation and how the things go. The paramedics would have to be trained. Just a footnote here, when I started working in EMS as an EMT, we only had one paramedic. And we were always concerned when that person got sick or needed leave or was unavailable to us. Today, our EMS program here in Custer County, we have 7 paramedics. We have 7 EMTs that have additional training, and we're happy that on every shift there is at least 1 paramedic available. Now, if we get a second call, that's a different scenario. But those paramedics would be trained in using this mobile integrated system. And of course, we've got to, as Heather would understand, get the buy-in from the other end, the physicians, the primary, the specialists, to say, hey, are you going to be available during a certain time to respond to any calls that would come in from remote areas like Custer County.
So Ron, is the trigger for this always a 911 call? So it's always the sense of emergency that we...
No, I think as this program evolves, we may find that you can schedule appointments and maybe not use 911. There would have to be a dedicated phone line so that person could say, I'd like to have a paramedic come out and check this or that. So I think it won't be just emergent kind of scenarios. And as Heather mentioned to me, Colorado is behind in getting this done. Other states have already rolled out such programs. Trinidad, for example, EMS already has a program, mobile system in place, and they're moving forward with it as we speak. I don't know where their funding is coming from because the grant for the state really hasn't even gone out yet. So that's kind of it in a nutshell, and I think we will see in an ideal scenario either making an appointment to have a paramedic come out and do whatever needed to be done, connecting with a primary care or a specialist in that person's home if they're feeling comfortable doing that. And we think there's a great value in that for elderly folks. I think, no offense to our clinic, but being able to have someone come into your home and talk to someone there is going to be a lot more user-friendly than having that person come to either the clinic or the library or wherever telehealth is available.
So I always get confused about the relationship between the clinic and the hospital district. So would ultimately there be potential coordination between
There would have to
for all of that, so that
there would have to be
that paramedic would be
step in
serving
on that.
like the nurse or...
So there could be, I mean, typical community paramedicine programs, which is what Ron is describing, there's typically a dedicated physician that's available or a group of physicians, like an emergency medicine group or a hospital emergency physician that they'll connect with, particularly around the 911 calls. And the paramedics are able to work on protocols and orders from that physician to try to not have to transport the patient. You know, there's certainly limitations depending upon what's going on with the person. You're not able to get a lot of diagnostics that way, but some can be robust where they've got like some point of care labs that they'll have available to them, or different medications that they can administer to patients based on the physician's orders and things like that. But it's typically an emergency room physician that's on the other end of that. If they do expansion to offer appointments where people can connect via telehealth that way, I think that's probably our opportunity to collaborate with them.
So,
Ron, I'm sorry.
go ahead, Kath.
Is this something that you're thinking about for next year? I realize some of this is dependent on other groups and state groups and so forth.
The funding for this program probably starts this summer, within the next couple of months. I know they've pretty much, Gina, the RFP is probably coming out in June with the first round of grants probably coming later on this summer. So it's something we're looking at in 2026.
Oh, wow.
How far along we can get. As I say, the program is still evolving. I don't think they're making it up as they go along, but as Heather mentioned to me, Colorado is behind the 8 ball. They're a little slow in getting it rolled out here in this state. But that may be because there's so many people, so many players in the state in terms of rural and frontier counties. But I would ideally anticipate something going on by this summer. And the grants are going to be specific in terms of, okay, you're going to be asking for a pot of money that would be utilized for paramedic training, equipment, any of the other things that would have to unfold to make this a reality.
Do you have the infrastructure for this in place yet?
Nope.
Okay.
I think that's probably where the dollars come into play, because you do have to have infrastructure.
Yeah.
The ambulances have to be fit with the technology. I mean, it's a big undertaking, but it's people that do it well, communities that have these programs, that they're very successful. It's just really getting everything in place to be able to do it properly.
It sounds like an exciting opportunity. You had a question.
I do. Two-part. When I hear you talk about offering this service, it reminds me of services we had when we had 24-hour on-call from nurse practitioner and one of the other providers back in the early 80s. And they would come to the home and they would be accessible around the clock if there were accidents or injuries in the home. So when I think of that, that was a sense of comfort. This, I'm wondering what kind of schedule would one have to fit into if reaching a specialist or a doctor by telehealth was required, determined by the paramedic on site, versus, you know,
Yeah,
let's
so
schedule you
that's-
to come in 12
Yeah,
hours
that's-
from now when we're actually
That's why
in
it's
the clinic.
typically staffed by emergency room physicians, because they're available 24/7 in a hospital setting. And so for the 911 component of this, it's whenever the patient calls and has an emergency or has an acute problem that they need the EMS to come for, they would have access to a physician. Scheduled specialists or regular primary care, you're really gonna be kind of subject to kind of standard business hours, so to speak.
Yeah. That's what I would be thinking. Certainly if it's an emergent situation, someone's gonna be responding quickly. Paramedic's gonna be there along with an EMT and whatever support is needed in the way of personnel. If it's a primary care, or as you say, a specialist, we're probably looking at a schedule during the day where we know that your provider or a provider is gonna be available from 8 to 5 or whatever the flow may be. And we've also got to get buy-in from those folks as well. And that's been, I sense, a reluctance right now, and maybe it's an educational thing that we've got to overcome in terms of how valuable this is. More important, when you live in Custer County, it raises the bar on everything. Services, the number of personnel available to assist. I've been pushing for a long time to consider urgent care, and I know Heather doesn't like to hear that all the time, but I've been a bee in her bonnet for a while on this. But she's educated me in terms of how technical that's going to be, because you can't just have an attending a paramedic or a PA at the hospital for extra hours or at the clinic. You've got to have backup, you've got to have staff when he or she is not available. So we're looking at having 2 or 3 permanent staffs that would have an urgent care facility available to them. So there's a lot going on there, and I appreciate the help Heather has given and educating me on that whole parcel. Did we answer your question?
I think so, but now I'm a little confused. So there are discussions between the hospital district and Heart of the Rockies as to whether or not we might someday have home visits?
So here's what I'll tell you about
Okay.
This is where it gets a little tricky. So our providers, like our nurse practitioners and our physicians that work in the clinic, can do a home visit during regular clinic time if someone is unable to leave their home. The problem with that is they have to have it documented that that person is homebound. Medicare will not cover it unless they are certified by the physician to be homebound and have to require them to come into the home to see the patient. It's the same reason why we can't do nurse visits out of the clinic because Medicare doesn't allow that out of a rural health clinic. So we're kind of bound by some regulations. For a long time, they would say, okay, you can submit an application to have your nurses be able to do home visits, and if we deem you as a shortage area where there isn't any services, we'll grant that. And never have I seen anyone ever get approved for that. We've never been able to get approved for that out of our rural health clinic. And so that's definitely a barrier, but our physicians can do a home visit if the patient is certified as homebound.
And they become homebound with certification by whom? They're
Certain diagnoses and by the physician.
so they have to have a PCP, or they can get it from an ER doc, which, I mean.
Yeah, from a primary care, but it's certain diagnoses. It sounds simple, but it's really not as simple as you would think it is. But there does have to be qualifications.
And where does one go to look up what those are?
You could probably find it. There's things called LCDs. Medicare puts out CMS about what covered diagnoses for different services exist. They're easily found if you Google them.
LCD?
Yes.
Thank you.
Ron, so as I've heard you discuss this before, that at some time, it almost sounds like EMS becomes the urgent care solution in our county in the short term, right?
And yes, that would be the case.
And there are financial savings for our EMS potentially in having this opportunity to work with people in their homes versus transporting everyone, right?
Correct.
Okay.
Yeah, we would much rather work with them in the home. Our number of refusals has gone up, but after that refusal form is signed, we will have already done a full-on physical on that person, and no labs, but we will have assessed what's going on there, and in a way that is urgent care. If that person is feeling chest pains, if that person is feeling dizzy or some other way, and our paramedic can diagnose it on the spot as it's this, not that, and we try to cancel out things before we move on to what the specific diagnosis is, that person may refuse transport and say, okay, I'm feeling better after you came to see me. And that's just this.
Does that happen now, or does everybody go to, okay, it happens now
It
too?
happens now.
Okay.
So at one point, way back in the day, there used to be EMS 1, EMS 2, and then paramedic. Is that still the way?
Well, M2 basic, M2 advanced or intermediate,
Okay,
and paramedic.
okay.
And it depends upon the hours of training that you've invested in and what you're eligible to do. The paramedic certainly can administer drugs that an EMT cannot, and what have you. So you're close as far as the numeration goes.
Like I said, I go way back.
Yeah, well,
As
I
far as
understand that,
training.
and I want to talk to you after this about whether that was all in Custer County or what have you.
No, it wasn't exactly, but
Okay,
yeah,
all right.
family members, another state, and that kind of
Got it,
thing. So I
okay.
do have.
Any other questions?
Yeah.
Thank you.
Thank you, Ron. Sounds like we have an exciting opportunity ahead of us.
Yeah, I hope so.
I also think it'll be very good for Alzheimer's patients in the community that they might have the option for someone with medical training to come to their home. It's often hard for them to get out of the house with a caretaker. So, Desiree, you're on deck. You all set?
I'm set.
All right.
First of all, I'd like to say, I don't know if you're aware that 20% of residents in Custer County don't have access to any broadband services, internet, and I think that's a significant amount of people. And so what all of us on this panel, I think, are offering in the way of telehealth is extremely valuable to our residents of Custer County. Sol Vista started using telehealth for psychiatric services long before the COVID epidemic. We had psych providers that were located in various parts of the state, even out of state, that we were utilizing. And our area of Colorado is a psychiatric desert. It's very difficult to get any in-person psychiatric services, whether that is a nurse practitioner, a psych nurse practitioner, or a licensed psychiatrist. And so telehealth is extremely important with that. So when COVID hit, Sol Vista was able to, within 72 hours, make every single employee remote. And so our clients did not lose services for any length of time when we had to shut down our offices. And so, yay, but what happened was, after all these people realized they could work remote, it's really difficult to get clinicians now to agree to work in the office. And so our struggle is getting in-person services for people. So our office here in Custer County, which is located right across from Antlers, which is so convenient, we have one full-time person in that office that provides in-person services as well as telehealth. And then we have another clinician that comes up once a week and sees children in person. And we have a full-time admin assistant. We have a designated telehealth office in that building, and anybody who's a client of Sol Vista can utilize that office for psychiatric or counseling services. So if you're an enrolled client with Sol Vista and you don't have access to that if you don't have access to Zoom, and that's the platform we use also, is Zoom, which is HIPAA compliant, then you can come in the office and the AA will set you up in the Zoom room and you'll be able to see your provider over Zoom. Another utilization we have for our Zoom people is our mobile crisis unit. So we cover all 4 counties with mobile crisis. So if someone is having a mental health crisis and needs services, we have peers and clinicians that respond to those services. And one person will be in person, and then the second person can show up via telehealth and assist that. So generally it's a peer that will come in person and then connect to Zoom, so the clinician will be able to talk to that client right then and there in their home or wherever the crisis is occurring. It really is beneficial, in my opinion, for our clients because of many of the things Heather's already talked about, but transportation issues, childcare issues. We are mandated to see Medicaid clients, right? That is the bulk of our clientele. We also see other Medicare clients and private insurance, but many times, the financial limitations for childcare, for transportation, greatly affects how people, or whether they get services and how often they come in for services. So telehealth really advances that opportunity for those clients. You do have to be an enrolled client to use our telehealth services at Sol Vista. But we probably I'm gonna guess at this point in time, more than half of our clientele are telehealth. Yeah. What I'd like to see expanded in Custer is our ability to serve Medicare clients in person. That's, I keep pushing for that. Because what Ron said, I think it's a difficult population to get totally on board with the whole telehealth thing. And getting our clinicians certified or credentialed, I should say, to be able to see Medicare clients. Because that's a process. Yeah.
Do you see VA clients or?
We absolutely see veterans and we do TRICARE. And we are in that group that, they give you a waiver if you live so far away from a VA center. So yes, we absolutely serve veterans. And we do groups, telehealth. That is really a wonderful thing because we are able to, we cover 4 counties. We cover Lake, Chaffee, Custer, and Fremont counties. And so if we offer a group, it's great because it's, we can get people from all of our catchment area to join that group and get engaged.
Does the 4-county coordination, do you guys work with UOCOG on any of that? Because it's the same counties I noticed that UOCOG covers, right? I just wondered if, in terms of adult aging services, whether or not
We
you
work with UCOG all the time. I mean, they're located right next to us in Canyon City.
Okay.
We share a parking lot.
Okay.
So, we've worked for years with UCOG.
I was just curious if that might impact the expansion of Medicare services, whether they could help with that, the Office on Aging.
No.
Okay.
The issue is getting our people credentialed,
Okay.
and that's a internal process.
Okay, that's kind of what I wanted to clarify, but you're aware of the demand for.
Oh, absolutely.
So the barrier is clinicians getting certified and wanting to do it in
Credentialed.
person.
Yeah, what?
And wanting to do in-person work versus.
Yeah, so like I said, the one person we have in person in Custer is not credentialed to serve Medicare clients. And so I personally would like to see that change.
Is that a hard process to get credentialed?
It is, it's a long process and it's a lot of paperwork and we have one human in our agency that credentials all 7, I don't know how many clinicians, I think we have 60-some clinicians, and is responsible for all that, so.
So the alternative would be to go to Heart of the Rockies Behavioral Health?
Or see
For
some,
Medicare.
Or see someone privately.
we have availability for Medicare clients via telehealth.
Okay, I see. It's
I'm
in
talking
person.
about
Gotcha.
in person,
Gotcha.
yeah.
So, when you say there are groups, on Zooms through telehealth, are they theme-based?
Yes. So
So,
we have grief group, we have DBT, didactic behavioral therapy groups, we have substance use groups, we have anger management groups, we have skill-based groups, a wide variety of groups, yeah.
Any more questions for Desiree at this moment? Okay, thank you. Thank you, Desiree.
You bet.
Jenna, you're up.
All right.
Now we get to the logistics. How do we make this happen?
Get my stuff out of the way so that I can get my other stuff. So obviously, library staff cannot actually provide any health services because we are librarians, not medical professionals, but we can help facilitate, which is our goal with these telehealth kits that we've put together. And the idea of this is you can check it out, same as you would a book, borrow it from the library for 10 days. And it has ideally all of the basic equipment in it that you would need for a telehealth appointment.
Including a
From-
hotspot?
Yep.
Okay.
Yep, so that's obviously one of the biggest barriers in Custer County is lack of access to internet and technology. So these come with a laptop and a hotspot. Those are obviously the key component, but it also has some basic health equipment, blood pressure cuff, and this thing has so many pockets that I'm always like trying to find all the stuff in here. A thermometer, one of the forehead ones, you can take your temperature. And then the pulse oximeter, which should probably take me half an hour to find in here, but it does have a pulse oximeter. And then there is also some equipment for the actual video call. So this is a very basic ring light, so you can have the model lighting with your doctor on your video
So
call.
you look your best.
Yeah, you look really good. And then there is a webcam in here as well that hooks onto the top of the laptop if you need better video quality than the one that's built into the laptop. But the idea is you borrow this from the library, you can take it home, you don't have internet at your house, or you don't have a laptop, whatever it may be, you can be in the privacy and the comfort of your own home for this telehealth appointment and have free equipment. Library staff are trained to show you how to use the laptop and the webcam and everything, so if you need a little demo before you go home, they can set you up with how to use the hotspot and get connected. And of course, during library hours, patrons are encouraged to call us if they need help with something actually at home. And then the other piece, because we know that some people are just not comfortable with the technology and the equipment at all, and they want help getting it set up. And we can't send library staff to your home, but maybe we can send a paramedic here soon. But they can come to the library for their appointment and book our privacy booth, which, if you're not familiar and you want to see it later after this, Kathy is happy to do some little tours of the privacy
I was
booth.
gonna say, tour guide.
But so if a person is more comfortable having library staff help them get set up with the laptop and Zoom meeting or whatever it may be, they can book our privacy booth here. It's set up, it's just for one person, it is quite small. But it is I don't want to say it's totally soundproof. If you're in there yelling, we'll hear some muffled noises, but it's does pretty well with muffling sound, so you can feel comfortable that you're having a private meeting with your doctor. And we can get you set up in there with the equipment, so that if someone is not comfortable with the laptop or a hotspot or whatever, they can just schedule their meeting for during library open hours, and we can reserve the booth for them and get them set up on their meeting in our privacy booth.
Don't you have a relationship with Rotary somewhere in here too about the van service?
Just for transporting people to the library.
Okay.
So
They couldn't deliver one of those kits to somebody who couldn't get here? Okay.
no, we're not set up for that. But if they want to come to the library, if they want to make an appointment for the booth or for any of our programs, they can schedule that through Rotary and get a
is the
free
cost-
ride to the library.
I was just gonna say, the cost is covered, right? Okay.
Yes, yes. So if transportation is a challenge, they can. And of course, if they want to get a ride here and check out the kit and take it home, they can do that.
Okay.
The patron can check those materials out themselves. We're just not set up to have delivery
Okay.
of materials by Rotary, but they can come to the library for free. So with Rotary.
How widely? Sorry, you're fine. You can stand because I just wondered. I've heard tell that you have 50% of your clients are remote. Ron's anticipating it. Heather, do you have any idea how many telehealth appointments happen around from our clinic, from our local
any
Okay.
day, it just depends.
And then I'm just curious how extensively these have been checked out or the booth has been used.
The booth is used very consistently,
Oh, good.
not necessarily for telehealth. But a lot of people who have, business calls, or, we have had people use it for appointments with their therapist, which I guess would be a form of telehealth. With their own devices, people do use it pretty frequently for a private space. The kits have not really been used for telehealth specifically, and I think really the issue with that, as we've already kind of covered, is the people who are using telehealth are people who are already comfortable with the equipment, the software. They don't need the kit because they're just on their smartphone, or they have their MacBook at home that they're doing the appointment on, and it's not really a concern. So the barrier is so large, the digital divide is so large, that the people who really need this equipment are not comfortable using it. So
What do we do about that?
that's the challenge that we're facing. And we have, we also use the booth for our virtual legal clinic. That's a monthly, we have 4 slots every month, free 20-minute legal clinic appointments. And a lot of those people are not comfortable at all with technology, and we set up the laptop and everything for them, and that works great, but obviously a little bit different than a health appointment. So
And so the kids, you have how many that you?
we have 2.
Pretty awesome.
It's a great resource. It's just, people check them out to use for the laptop and the hotspot, but which is fine. That still is using it, but getting to that point of, oh, I can use this for a telehealth appointment, we haven't gotten there yet. So
For Gina's benefit, oops, sorry, ask your question. I was just gonna say, this is why I wish we had a navigator, right? Like somebody to point people to where to go, but okay.
The original idea with that Rotary partnership was that trained folks would be available to go with the kit to people's homes, and that's not worked because.
I think it was mostly just there were too many logistical challenges with that, and there were some misgivings about using Rotary resources for that when they're already struggling to find drivers just to get people to appointments. So I think the concern was piling on to the workload when they already were a little bit overwhelmed. But we have had great success with bringing people to the library for programs and to check out materials. We have a couple people who have been using that service consistently, and it's been really well received. Just that extra piece was a little too much for the current capacity.
It was a lot.
So.
It was a lot.
I would also add that we have tech help it's gonna be 3 times a month now, starting in June. It's the 2nd and 4th Thursday of the month, and that's from 10 to noon. And now we're adding a Friday afternoon, the 3rd Friday of the month. It's also on our website, and that'll be from 2 to 4 in the afternoon. And if someone is maybe struggling a little bit with maybe downloading Zoom onto their laptop, or they're not sure exactly how to do a telehealth appointment, that would be something I would also bring to tech help, because there's no appointment needed. You can just drop in, and you could do that prior to an appointment to maybe make yourself feel more comfortable with the technology involved, for those who are a little more adventurous in that area. But that's something else that people can do.
Do you ever have any of the tech help days be around Zoom? Like, get help with your iPhone and your hearing aids this week, or get help with your, I don't know.
I've tried, but one of the things that happens is I find people are in the moment of what's the concern in their life, whatever that may be. And a lot of times it has to do with phones and tablets. Our technicians are asked from everything to, I don't know how to remove something from my phone, or I've seen one person come in, their voicemail was full from like 2 years ago, and all kinds of things like that. So, but these are people who struggle with basic things in a lot of cases.
they do get some people come in, like I know someone who's coming in June, to get help with her Gmail.
Mhm.
And, so there are some people who will come in and get more extensive help,
Mhm.
but a lot of times they're very basic things with their phones.
I was just wondering about the opportunity to build more awareness of the telehealth options by offering special training sessions on stuff. But the turnout for just the information session was poor, so I don't know how it would be for the application part, but.
We've tried doing classes.
Mhm.
Kathy's tried doing tech-specific classes in the past, and it's just never really, you know, you might maybe one or two people, and even when people have come in and said, oh, I would love if you did a tech class on X, Y, or Z,
Mhm.
and then of course those people never come when
Right, right.
when we have those classes. So having the drop-in, very casual, seems to work better for people. I don't know if it's less pressure or
But
what, but
again, just
it's-
awareness of the people who do know what telehealth options, to be able to let people know that they could get help in the tech.
I want to let you know I have cards and things over here too, if you need information on Sol Vista.
Thank you, Desiree. Any other questions before we wrap up? I just want to say thank you to everyone on the panel for joining us, and maybe hopefully we could do this again in the fall. We'll pick a less snowy day, but I don't know, Super El Nino may not cooperate with us. So thank you, everyone.
Thank you.
Thank you for having us.
Thank you, driving down.